The NHS Constitution says that patients have a right to be informed about research. Equally, of course, patients have the right to say, no, thank you, they don't want to take part in it. The approach we recommend is that patients should be offered research as an integral part of their treatment choices. When you're making choices about treatment after you've been told you have cancer, the choices you make are based on all sorts of things. Some of us will look at things on the internet, some of us will take our doctor's advice, some of us will listen to friends. So it's a complex decision process that you make. Sometimes we want to help others, and that's a driving force for a lot of cancer patients who decide to take part in research. Sometimes, of course, we're simply looking for the best possible solutions for our own situation, which may or may not come from research. Any form of research is a test. What's available now against what might be available in the future. So there is a certain element of risk. Taking part in research can never guarantee you access to new drugs or new treatment, nor does it necessarily mean that those new drugs and new treatment will prove to be better than the existing ones. But that's what the test is. All the treatment I've had as a cancer patient has come about because patients before me volunteered to have research, so we know what the best treatments are. I volunteered for research to try and make those treatments better for patients who come after. My experience of cancer and cancer research goes back over 12 years now. I've had cancer twice in that time, 2 different cancers, and I've taken part in 4 clinical trials. The first one was a standard drugs trial, which was existing drugs against a combination which we think will cure more people and leave fewer side effects. Second trial was a trial of PET scans, which are now perfectly standard. More recently, I've taken part in a very small local trial, which was just about wound healing. I had skin cancer, they take lumps off the skin, and they were simply testing to see different techniques to see how quickly the wounds would heal. For that kind of thing, you don't actually need to be a cancer patient. The trial is in the healing of wounds. My advice for any patient approach to do a trial would be to think of what it means for them personally, and not just in terms of the health considerations. Some trials will involve travelling to different hospitals for different procedures. Some trials will involve a lot more time than the ordinary treatment will, which may involve commitments for other members of their family, if there's children to be picked up from school, that kind of thing you have to think about. My own personal advice, though, would also be to think of the advantages. And again, it's not just treatment advantages. On a trial, you are likely to be checked more often than other patients. You will have to have more blood tests, which personally I hate because it involves having needles stuck in you. But at the same time, it's quite reassuring to know these things are happening. You may well have to have more scans, which again may involve more travel, more time lying under machines. Personally, I found that quite comforting to know that I was being checked up in that way.